Chief Pediatrician, Masonic Children's Hospital, to welcome the gathering.
Good morning, everyone. On behalf of the trustees, doctors and staff of Masonic Medical Center, I welcome you all for the 28th Prof Arnold Einhorn Endowment Oration held in our first Pediatric Institute of Coimbatore. This year, our guest orator, Sir Dr. Vedanthan, who has readily accepted to our invitation and agreed to come to Coimbatore to deliver this lecture and sharing his experience in food allergy changing patterns. He is now the clinical professor in medicine division of allergy, asthma and immunology in USA. A big welcome to you, sir. I welcome Madam and his family who has come with him. Welcome to you all, Madam. I welcome my professor, Dr. M. Ramsamy, a policy advisor who is instrumental in starting this oration in the name of his mentor and running this session continuously for the past 27 years. I welcome you, sir. I welcome the office bearers of Coimbatore chapter of IFC, IMA, Dr. Pudupakkam, who have come in large numbers. I also welcome the senior pediatricians, the HODs and assistant professors and postgraduates of different institutions in and around Coimbatore. A warm welcome to our senior professor, Dr. Ravikumar, pediatric surgeon, who has readily accepted our invitation to be with us for this function. Welcome, sir. Welcome our CEO, Dr. Ishwarmurthy, in guiding us to make this function a grand success. I also welcome my colleagues, postgraduates, office staff and paramedical staff in helping us in all the ways for the past 1 week in making this function. Welcome to Dr. Anthony Teres from GKNM Hospital, who has readily accepted to introduce the guest speaker. Last but not the least, I also welcome Dr. Jagannath and his team of Reddy's team for sponsoring this function. Once again, I welcome you all for this oration. Thank you.
Thank us about Professor Dr. Arnold Einhorn, sir.
My esteemed colleagues, including Professor Ravikumar and all others, whose faces are very familiar. If I don't mention individual names, please pardon me for that. To preside over the year's oration, this year is special because we have with us an alumnus of Oration University, who has been acclaimed nationally and internationally as a foremost allergist. Fortunately for him and for all of us, his heart and soul are in India, even though his family is permanently settled in the USA. Let me extend a very warm welcome to all of you once again for sparing your time this morning, Sunday morning, to attend this oration. Let me say a few words about this institution before I move on to say a few more words about this oration. This is the only children's hospital in Coimbatore that has come up by public contributions from philanthropic-minded Freemasons as well as senior citizens in and around Coimbatore. It was founded in the year 1983 in a very small room on this old palatial building on the first floor with one part-time pediatrician with the 50 paise per child. That was long ago. And a few years earlier, in 1983 and 1978, this whole property measuring 2 acres and the palatial building was bought by the Freemasons of Coimbatore. For some of you who do not know what Freemasonry is, I must tell you it is a fraternity of men who believe in belief, truth and brotherhood, and whose primary aim is to improve the moral character of human beings. It has its roots to King Solomon of Israel. And so this property was purchased by the Freemasons of Coimbatore in 1978. I must tell you, 2 senior Freemasons, one of them is no more, late Mr. N.R. Doraiswamy, a chartered accountant, another Mr. Somasundaram, an engineer. And along with them, I was extremely lucky to have an assistance from 4 of my colleagues, pediatricians, Dr. Nandini Kumaran, Dr. Krishnaswamy, Dr. John Mathai, Dr. Usha Yadagu. I was also very happy in the initial years to get assistance from 2 pediatric surgeons eminence, one Professor Ravi Kumar, another Professor late Ram Kumar Raghavati. So we started about 5 or 6 or 7 people, and now it has grown to the present state where we are able to care for 60,000 children a year as an outpatient, 6,000 children as inpatients, and provide both general pediatric and subspecialty care. Now, this is about this institution, which, as I mentioned, has come out by public subscription. We believe very strongly, we continue to do so, that every child that knocks at the door should get attention from our hospital, whether they are in a position to pay or not. However, resources are not infinite, so we do accept the fees from those who can afford to pay. That has been our philosophy from the day we founded. We try to adhere to the maximum extent possible. Now, regarding my mentor, whose portrait is there, he is not only a gifted general pediatrician, but a doyen among American pediatricians of the previous generation. And he not only a gifted general pediatrician who would speak about 6 or 7 languages, a tremendous common sense, but I would also describe him an alchemist who could change an ordinary clay into a useful metal. That's what exactly he did to me. He trained well over 1,500 pediatricians who are there in different parts of the world, different continents. Of course, I am repeating the sermon year after year, but nevertheless, the audience is always new, so it doesn't really, it's okay. Please, initially, it was at the Albert Einstein College of Medicine in New York City. He was there for about 15-20 years. Later on, he moved to National Children's Hospital, Washington, D.C. Indeed, if you look at the year he was born, 1920, yes, he passed away in 1923, he was born, passed away 2020, 3 years short of century. And when he passed away, the Children's National Hospital, the 4th largest or 3rd largest hospital in North America, obituary note said, the world has become a bit darker. So that was his contribution. He was born in Belgium. Family unfortunately had to flee because of the Nazi invasion of Poland. And then he went underground, worked for the British Army as an underground agent during the World War II. Then after the World War, he joined the University of Paris and came out with honors in pediatrics, immigrated to United States in the 1950s. It was there at that time. I was hardly about 24, and I joined the Lincoln Hospital, affiliated to Albert Einstein College of Medicine, as a first-year resident, where he was then the director. And I was with him for 3 years without my knowledge, without any effort on my part. I became a fairly competent and compassionate pediatrician. The reason why I say compassionate pediatrician, on one occasion during the rounds, he asked all of us, how many of you want to become rich? We all raised our hands. We were 14 from different parts of the world. And then you put down your hands, he said, I have one suggestion to make. If you want to become rich, become the agent of Bata stores. I could never forget that. So the money has never been in my mind. I haven't become poor either. The money has never been in my mind. So that is the thing he taught us. Now, so the membership under him stood me in great stead when I came to practice in Coimbatore. That was in 1968. I was absolutely confident. I was fairly competent as well. Of course, I can't do that now. The science has grown so much. I was able to handle every sick child with good success rate. And after 2 decades of my practice, an opportunity arose. I was requested by the female Coimbatore to help them to start a children's clinic, and that's how it started. As I mentioned to you, it has grown to the present state. So thank you very much for your patient hearing. We have a long way to go. Fortunately, I'm very happy. Like I was fortunate 30 years ago, I'm also fortunate now. I have a band of very dynamic young pediatricians who are also such fellows who are very, very keen to take this institution forward. So thank you very much.
Thank you, sir. We now request Dr. Anthony Terence Benjamin, sir, consultant pediatrician and pediatric pulmonologist, GKNM Hospital, to talk to us about the guest orator.
Respected mentors, Professor P K Vedanthan, Professor M.R. Sir, Professor B. Ravikumar Sir, CMO and CEO of Masonic Hospitals, fellow pediatricians and dear friends. I am very pleased to introduce my mentor for 16 years, Dr. Professor P K Vedanthan. He is very fondly known, I think, throughout the allergy circles as Dr. PK, and was born in Mysore in the year 1947 and attended school there. But his family has his roots in Tamil Nadu, near Kanchipuram. That's how we got his name, Pudupakkam K Vedanthan. And his father was a very busy family practitioner there. He was very inspired by his father to take up medicine as his career. He did his MBBS from Masonic Medical College. எல்லாம் தமிழ்ல சொல்லுவாங்க விளையும் பயிர் முளையிலே தெரியும் அப்படின்ட்டு. He excelled in academics and he got 3 gold medals in physiology, pathology and pharmacology. Then he decided to go to US for further training. In 1971, with his wife, he went to United States. He trained in pediatrics and then moved to allergy, asthma and immunology. He got board certifications in both. He established his practice in Denver, Colorado, and he has been serving as a clinical professor in the division of allergy, asthma and immunology at the University of Colorado. And he wanted to do more. He thought himself as a global physician. Therefore, he founded the NGO called International Asthma Services, and through that, he has done lots of free medical camps in India as well as in lots of developing countries worldwide. He is instrumental. I will say that he is the father of allergy in India. I think most of our trainees consider him as the father of allergy. Because before he came, there was no formal training for allergy in India. He is instrumental for formal training courses for allergy in India. He is a visiting professor at CMC Vellore, PGH Chandigarh, AIMS Rishikesh, as well as at Gangaram Hospital. And he is the co-director for many allergy courses. The important ones I have mentioned, there are lots of courses. Diploma in Allergy and Asthma from CMC Vellore, DPAA, I think that's from Gangaram Hospital. And now recently, he also is a co-director for DPSM. It's a sleep medicine course based in Bangalore. Paramesh Oration in Respicon 2016 at Bangalore. He also did the Professor Somo Oration at Respicon 2020 in Chennai. And for his work in allergy, asthma, as well as the international education on asthma and allergy, he received a very special recognition award from American Association of Allergy and Allergy, Asthma and Immunology in 2022. He has authored many textbooks and has many publications to his credit. He is a very gifted teacher, and those who listen to him can recollect that his sessions are very lively, energy giving. Most of the sessions, most of the lectures will drain our energy, but if you go to his session, you will come out with lots of energy. And sessions are infused with lots of humor, and it's like going to a laughing club and coming back. He loves traveling, adventure, music, and yoga. Lots of things I can say about his hobbies, but lack of time, I'm short and everything. And better off is Mrs. Kamala Vedanthan. She's here, and she's a professional vocalist and a musician, and she has been the pillar of support for him throughout his career. And they have 2 grown-up children. Dr. Rajesh, who is a cardiologist based at New York, and his daughter is here. She's Nanjani, and she's the director of School of Music and Dance. And they have 2 grandchildren as well. And we also welcome the family friend Andrew who has come here with us. Yeah. Professor Vedanthan, we are blessed to have you here as a guest orator today for this very prestigious Professor Einhorn Oration. Thank you all.
Thank you, sir. We now request Professor Dr. Ravikumar sir to hand over the book to.
This is a biography of mine. I have chronicled from my roots to the present position the title is from presently to pediatrics. And this sums up nearly 8 years of my professional life right from the farm to the pediatric. I have great pleasure in requesting my colleague, senior professor, Professor Ravi Kumar, senior most pediatric surgeon, to hand over this book to Professor Ravi. As follows: Professor Arnold H Einhorn's Endowment Oration 2025. To the honor awarded to Professor Dr Pudupakkam K Vedanthan in appreciation of his lecture on food allergy changing platform on Sunday 25th February, Masonic Children's Hospital. The motto is expert care 24/7 for every child, and signed by Chief Executive Officer, myself, Trustee, and also Chairman. With the true gold, the value is going up. True gold, every year the value is going up, despite their promise.
First of all, I never heard an introduction that long given by Dr. Anthony. Thank you so much. And distinguished members of the Masonic Children's Hospital, Coimbatore, especially Dr. M. Ramaswamy, Dr. Krishna Swami, Dr. Murthy, and our senior pediatrician, Dr. Ravi Kumar, senior most pediatric surgeon. I think it is not only Coimbatore, maybe to me, senior most in India. And my favorite students here, there are a couple of more students, at least 4 or 5 of us. I don't call them students, I call them colleagues. And many physicians right here and friends. And very special today, my family members are also here. My Mrs. Kamala, my daughter Anjani, and our friend, family friend, and her boyfriend, Mr. Andrew, Andy, Neely, we call it Andy. And so this is, and all our friends here. Thank you so much for making this possible for me. To me, this is the most compassionate children's hospital I have ever visited in my life. I am not exaggerating. We always go by say, which children's hospital? Second question we ask is, how many beds you have? Third question, how many beds ICU? And it ends there. But here it doesn't end, because you have so many pluses. This is the one hospital that is providing free care to thousands of children across the state of Tamil Nadu and maybe more. Maybe sometimes we don't know where these people are coming from. Okay. And the compassion that is delivered at such a tender age is most important. Pediatricians make our lives. It is the pediatricians. We all know a lot of diseases starts in pediatric age group. At the same time, a lot of good things also start in pediatric age group. Lot of things we are all made up as what we are today from what we were in the first few years of life. So pediatricians have a huge role in not only making us, keeping us, maintaining us healthy. We read pathology now. We are all going into this magic word called gene-environment interactions. Genetics play a big role in a lot of our diseases, and genetics starts as soon as the womb is developed. Make a difference in people's lives, not only in prevention as well as propagation of these diseases. So it's very important. So today my talk is a little different type of talk in that I'm talking about, so before I go further, I am basically humbled and honored to deliver this oration in honor of this incredible individual whom Dr. Ramaswamy had given you detailed description of his life, a life which is full of adventures, I would say. He was a Holocaust survivor as well as academician. So he was a great teacher. He produced 1,500, probably many accomplished teachers and pediatricians that are across the globe probably. Astute clinician and sharp diagnostician. We did not have all these EEG, EMG, CAT scan, CT, MRI. Now people just first order the test and then look at the patient. And patient comes to you, first thing he does is, they won't tell you what complaint, he will give you this from the bag, he will remove this file and give you this lab. So, want you to treat the lab, I want to treat the patient. So we always say, I will take it, but I won't open it. First I want to talk to you, then I will open it. So the tables have turned now. Patients believe in tests more than the doctors. So we need to make sure that the trust in the medical profession is maintained, having that good patient-doctor-patient relationship, not laboratory-patient relationship, not the test tube and machines with patient. It is human-human contact. Medicine should be human. Medicine is human. That is why it is never a science. It is a mixture of science and art. It is an art. That's why we keep on practicing it. We are never completely experts. So this individual was the chief pediatrician at one of the foremost hospitals in the country called National Children's Hospital. Before that, he was in Albert Einstein, where Dr. Ramaswamy was trained. And one other amazing thing, which is very unusual, is for such a incredibly trained individual serving in this heart of the country like Washington DC and a metro like New York, to come and visit and spend time in Coimbatore. And that is unheard of. Where he came for 3 to 4 months, I hear, I don't know, probably for several years, 4 to 5 years, 7 years. So that is a huge commitment. He probably left his family there and came here and worked with the children and worked with the disadvantaged, worked with many diseased, because the pathology you see in India, you will never see in America. You will never see. So this is where pathology is. And so he was one of the most highly admired pediatrician in the city of Coimbatore. I have never heard an American trained having that type of title, having a highly admired doctor in a city in India. First time I heard, to be honest. And so I am deeply honored to deliver this oration in honor of this great individual. Next slide. Oh, I got it here. So, as I mentioned, that Professor Ramaswamy, my sincere thanks to you for making this possible. And our dear student Anthony is the one probably started the whole conversation. Because you were trained here, Anthony, I know. And my special appreciations to Dr. Anthony, Dr. Karthikeyan, and several other doctors who have been trained. And my family members again, my wife Kamala, my daughter, engineer, and made this special today. And thank you so much for coming to this. So, let's go to the real thing. Everybody likes Indian food. Not just Indians. Lot of foreigners like Indian food. The first thing they say, you're from India. They won't say what job you have. Or, I like your food. Where do you get this spice, that spice? Where do you get the dosa? Where do you get this one? That is the third question. So the reason is, the spices that we use in India is unbelievable. And that is why you had probably all the we became colonized because not because of our riches, because of spices, I think. It's a spice war. So the Indian cuisine is extremely varied, and there is no country with this much of variety, diversity of food. Every 50 miles there's a different specialty. About a month ago I was in Surat, and I've been to Surat, I've been to so many Gujarati places, so many places. I have actually stayed in many Gujarati families' houses, but the food that was served in Surat, every particular item was unique. I had never tasted in my life before. So that type of variety we have. So what this slide doesn't, I don't have to explain to you. It is the most diverse intake of foods that we have. So at the same time, what we also have is the most diverse people we have, and the most diverse environment we have, the most diverse atmosphere we have. So when you have diversity in all these things, what happens is our lifestyle is also diverse. Our lifestyles are all different. We all eat differently. We are all eating differently. Every 50 miles we are different. We dress differently, we walk differently, our habits are differently, we sleep differently. I know in Chennai, I go 3 o'clock, somebody is walking around. The city never sleeps. In Mysore, everybody is still sleeping at 6:30 in the morning, 7 or 8 o'clock, he will yawn. His life starts then. Chennai is already running around. So why I am saying this? The reason I am saying this is lifestyle and diseases go together. Diseases follow lifestyle. So allergy is a lifestyle disease. Depending upon the type of lifestyle you have a certain type of disease. But there is another addition to that. That is what we call as a genetic susceptibility. We have genetic, we are all wired. We are all wired for many diseases. Not all of us get that disease. Only few of us get the disease. Say like you take 100 smokers, how many people get emphysema? Only 20% will get emphysema. 80% still smoking. Lot of people take alcohol, how many get cirrhosis? A certain number. Because there is a thing called susceptibility genes. You may be wired, but you also have a susceptible genes. So if you have a susceptible genes, and you are also exposed to that particular environment, the gene-environment interaction takes place and you get the disease. But one corollary is very important there. If you're genetically wired, you can become susceptible based upon where you live, and that is called epigenetic changes. Epigenetic changes, the changes happen on the surface of your gene in the amino acid configuration and makes you susceptible. And this susceptibility is bothersome. At the same time, it is not that bothersome also. What is bothersome is you are going to transmit the susceptibility to the next 2 generations. Unborn children are already susceptible. If you are genetically, if you have epigenetic changes, which we are, chances are I will transmit that abnormality to my son, and he will, or son or daughter will again transmit to the second generation. So it is transmitted to 2 generations. Good thing, epigenetic changes are reversible. If I change my lifestyle, if I start a life where I can walk around this race course every day, eat moderately, and maintain particular health, and not smoke, and not to go into any excesses, I can reverse the epigenetic changes, and not only I will be healthy, my future generation will also be. And that is the beauty about the lifestyle diseases. Many of them are reversible. Now, how do we know all this? By what we call as epidemiological studies. Epidemiological studies are most important in the field of medicine. If you don't know epidemiology of a disease, you never understand the disease. If I see a patient in the office, do I understand the patient or do I understand the disease? You understand the patient, not the disease. If I want to understand the disease, I have to look at millions of patients at the same time. And that is what epidemiological disease is. So, The people who have done the best job of knowing a disease are cardiologists. They did that Framingham study. They are the people who keeps everybody on their toes, and everybody is scared of a cardiologist. All of us just swallow these pills every day without thinking. Statins, blood pressure pills, this one. And he says, you can't smoke. Yes, I don't want to smoke. Why? Doctor told me. I have to maintain my weight. I don't want to eat this. I don't want to do this. I want to have a proper weight and all that type of stuff. Because the cardiologists, what they did was they did wonderful epidemiological studies and said, this is what you guys have to do to have a good life, and this is what keeps you healthy. And this is the power of epidemiology. So all of you came here and most of you drove your car today, and what you did was you put your seatbelt on, right? Am I right? And why did you put the seatbelt on? To save life, save yourself. And what is behind? Have you ever thought, why am I wearing a seatbelt? Who told me to use the seatbelt? What is the evidence behind the seatbelt? There is a huge amount of epidemiological study to show your seatbelt is what saves your life. So epidemiological data is very important. Wearing a helmet, not going too much in the sun, not smoke, eat moderately. There are all three words only. All primary prevention measures, only three words, not one sentence, no classification, three words. Why three words? Everybody should understand. Villagers should understand. Illiterate, everybody should be able to follow. Do we have such a type of epidemiological advice in allergy? Do I have a type of advice like that in asthma? Do I have one like that in food allergy or any type? We don't. We do not have that type of simple advice because we never did good epidemiological studies until only 20 years ago. We started doing epidemiological study only from 1990s. IgE was discovered in 68 and we came up with an inhaled steroid, the most powerful medicines that we have in 1971 without understanding the disease. So we are in a specialty where the cart is in front of the horse. Horse should be in front of the cart to pull it. But here the cart is in front of the horse and horse will not push the cart. So we need to put the horse again to the front. And so that is what we are in the process of producing, getting this epidemiological data. And that is what is happening now in our field. So this is general for all allergies. Now coming to food allergy, now we have got data. For the first time we never knew this. This we know only in the last 4 years, 5 years only. This data I am giving you. So Indian data is just coming in. All the data we have been we have been always using to come to our conclusions was Western data. But now we are realizing our people are very different from West. We not only dress differently, we think differently, but we are genetically different. We are different people. You cannot have Western data applied to us. We are coming to that. So our data showing, Indian conditions showing the lowest prevalence of food allergy is in India. Lowest prevalence. One of the lowest prevalences. And environment looks very harsh. You know, you got all dirt there. We always blame pollution. This one. You know, you go there, there's all these dogs around, there's a dirt around, there's somebody urinating there, there's a cow dung there. We are always blaming this is not right, that is not right, this is dirty, this. Genetics. We are all pro-allergic. Asians are more pre-TH2. We are already wired to develop allergy. I'll tell you more about that later. But why still low allergy? So genetically we are prone, environmentally we are this harsh, but we are still having low allergy. Why? I don't know. Now we are finding out why are we having so less allergy. We are genetically prone, environment is harsh, but compared to the West, I am having very little allergy. That is why rest of the world is interested in us. They want to find out, how is it you have low allergy? Now, why What is low allergy? I'll tell you what happens. Look at the last thing, food allergy. India, 1 in 1,000, 1 in 1,000 population, 0.01, 0.1 is the prevalence of food allergy to any food in India. 6 hours by flight, go to Australia, 100 per 1,000, 10%. Okay, that is 100 times more allergy in Australia. Singapore, 5, so 5 times more. UK, USA, 100 times more. See, this amount, I am talking about not the Caucasian population, I am talking about Indian people living in Australia, Indian people living in Singapore, Indian people living in USA. Same people, same genetic makeup. They move to Australia, they move to USA. Their children have 100 times more chance of developing allergy compared to the couple living here in Coimbatore or Mumbai. That is called acculturation. So what happened was, once these young couples go to these countries, everything, environment changes. Okay? And they are genetically, they have got here, pro-allergic, but the environment, whatever there, once it changes, there is in our environment, I told you, in spite of everything being harsh, our allergies are low. That means there is what we call we have a God-given gift called tolerogenic immunity. That is called tolerogenic type of thing. So we have something built-in tolerance in our community which is protecting us, and that tolerance is absent in the Western countries. Once I moved to New Zealand, that tolerogenic environment is gone. Things are clean. There is always, everything is clean. No more of this cow dung business. No more of this urine all over the place. No more of the dog urinating in your display in your bedroom. No more of the rat coming and doing another. So the reason I am saying all that, whether you like it or not, what are I am saying, rat urine, this urine, that urine is present in this room also. Why? Do you see it? No, I don't see it. Do you smell it? No, you don't see it. But somebody else does it. That is your immune eyes. Your immune system is so sensitive, it picks up everything. When you are closing the eye, your immune system picks up all dead material. Dead material. That is what we have, that that DNA analysis they call it. We found this guy murdered 50 years ago because his DNA is there. So those nuclear material stay forever. Stay forever. And your immune system will pick it up. Your immune system will pick it up. And when you do testing, it will show that your immune system has reacted to all these different things. And that type of thing is present in India. Our immune system is very active. That is why our sensitization is 26%. So when you look at food allergy, when you do skin testing, everybody is positive, this and that. When you take a history, there is nothing there. So immunologically, we are very active. Clinically, very well protected. You understand? If you do an immunocap, if you do specific IG, you do skin testing, positive, positive, positive. Talk to the patient, nothing. I am drinking milk, I am taking egg, I am taking fish, but sabbi positive yahan. Yalla positive. So do not treat stress, to treat the patient. Do not tell you stay away from it, continue eating because you are tolerating it. Okay. So never do screening panels for foods. Never skin test someone just like that, because patient comes and says, my child has allergy, can you check that brother also, I want to make sure. So pediatrician will say, yeah, I think it's easy. I'll get a blood work done. Just a lab fellow just left. There's a panel. We can use a panel. You do the panel. Once you get the panel, it will say 25 allergens, all false positives. Nothing is clinically significant. So we tell the pediatricians, never do panels. Never do panels. Do not do immunocap blindly. Always take a history. If the patient says, are you taking your milk okay? peanut okay, brinjal okay, mango okay, I don't have any problem, my child is eating everything. Do not test that patient. Do not test. If you test, you are going to find sensitization, because I already know 26% of our children will react. I don't know how to. Once I do the test and I get the test result, who is happy? Parent is happy. They think you are a very good doctor. He found something positive. What 3,000 rupees I paid and he showed already positive. But doctor doesn't know how to interpret. He's terribly confused and he doesn't want to show that confusion in front of the patient. He's scratching his head and he will know what to do. Yes, then he will say, yes, these are all positive. Eliminate all those foods from the diet. Mom says, should I eliminate everything? Yeah, it's positive, right? Yeah, okay. He'll come 3 years later, he looks like this, everything is down, he's looked catectic, he lost weight. We see these cases. All the foods were taken off from the patient unnecessarily. So what the pediatrician did was he was treating the test, not the patient. So never do food testing unnecessary. Never do panels. Do not do total IgE. Okay, do not do total IgE because that will also give a lot of confusion. Just spend a few minutes history. Do you have any trouble? If somebody has problems with some foods, most of them people know. I took this food, I have this problem. There is a thing called temporal relationship. I took this particular brinjal. She gave it to me lovingly, but my body did not love it. I started itching. That is a good sign. That is a good history. In 15 minutes I have itching. That means the IgE, the mast cells that are present right around, is liberating the histamine. The IgE reaction, antigen antibody reaction has taken place as part. That is a positive history. I took the brinjal, even lovingly. That night I had a little diarrhea. That is not allergy. There is no temporal relationship. It should occur within 2 hours. So the history is most important. If somebody says within an hour or two I had this problem, majority have it in 30 minutes, 25 minutes, 15 minutes. That is significant for us. Somebody having symptoms next day is not an issue. It maybe is more of a digestive problem, gastrointestinal problem, could be a toxic problem, it's not allergy. So temporal relationship is most important to diagnose food allergy. That is all you have to remember. Do not rely on all these different tests. History and temporal relationship. Now, coming back, here it shows that food allergy is very low because we have certain very positive things for us. We have high fiber diet. Most of our diets are high fiber and they are also low fat and they are fermented, and typical Indian diet, I am not talking about today's diet, is low sugar. There is nothing like a dessert in our thing. You go to Western country, you eat, and then you are still hungry. Then he has finished everything and he is still looking for one more table. Where is the dessert? Where is the dessert? Where is the dessert? Oh, that table. Because he wants to have the dessert, and that's the culprit. So they have found having this high sugar thing is promoting food allergy. Meats, people who eat meat only has the lowest allergy. High carbohydrate, especially dairy, like all these bakery products have been found to promote allergic phenomena. These sweets and all these type of cookies and all those things that you give it after the meal is what causes the problem. So in pregnancy, it's very important for us to advise not to eat these bakery foods, high carbohydrate bakery foods. This is what promotes allergy. And this has been shown. I'll show you the data. So there is a big orchestra in India. It is called Allergy Asthma Orchestra. There are so many factors, I cannot go through all that. And these are all factors that are surrounding here. These are all different factors. Shifting of population, all these things are what causes the disease. But at the same time, we have what we call as protective phenomena. Oh, thank you. we have what we call as a protective phenomena. These protective phenomena are high parasitic. Now, if you look at it, mobile. So, if you take my childhood, I'm sure Dr. Ramaswamy's childhood and some of the other senior people's childhood. Thank you. We were infested with parasites. Ascaris lumbricoides was a common thing. Ascaris, common. There was a syrup called Helmacid syrup. I remember I was taking it. My father would say, take this. We thought that they are all tasted pretty good. So, that one is anthelmintic. Nobody uses this anymore. Okay. But why was it protective? Is your immune system had something to attack. That was the parasites. It lies the parasites. So high parasite load was protective. So people, when you talk about allergy to older people, they said we had asthma, but I don't know what is this allergy business. I only was allergic to that person. I didn't like it, but they won't say I'm allergic to pollen and dust. They won't say allergic. High rates of tuberculosis, BCG vaccination we all have, that is protective. Higher load of endotoxin, that is microbial load. That is, if you go to villages, which many of you are very familiar because this semi-sata, you have many people who have lived in villages who moved here. So if you go to villages, Ramaswamy said, from peasantry
to pediatric.
pediatrics. So peasantry is the passion. Pediatrics is also passion. But peasantry is something very fundamental. It's almost like an innate type of property. People who are born in the rural area. So I am more of a town person, born in myself. So when we did a very interesting study where we look at atopic sensitization among children who are born in the city compared to village, only 40 miles away. And we found that children in the city were 7 times more sensitized, 6 times more asthma. So when we put all the data together, we found it is the cow dung that made the difference. Statistically, it is the cow dung that was used on the surface of the ground to keep the flies away was statistically important to keep the allergy also down. It was the close animal contact with cattle. So about 30% of those homes had bedroom in the cattle also inside. So there was all these cats, dogs, this one, big animals, small animals, cat outside, cow outside, everything is there. So this is all what we call as a microbial load. So microbial load was so high that kept the immune system so active that it did not have time to attack dust mite and pollens and cockroach. Coming to the city, there is no cow dung there. Nobody's putting cow dung. So they don't have all these animals also. Nowadays people are having more cat and dog, not when we did the study. So this immune system will start attacking something else like pollens and foods and this. So this is what they call as hygiene hypothesis. It's not hypothesis anymore. It's a proven thing. So all these things, prolonged breastfeeding. In India it's not uncommon to breastfeed child for 2 years. So these are all things that are helping feeding habits. Another, poor sanitation, overcrowding actually is a good thing for this specialty. Very good. I am the prime example. My wife is also a good example. My grandchildren are not good examples. Because we were a family of 6. 3 of our brothers, we used to sleep in the same bedroom. All the time we grew up like that. Fighting with each other, arguing with each other, and laughing with each other, spitting with each other, and exchanging all the bacteria. So we had this incredible microbial interaction every day. Okay, and that type of thing is actually which keeps your immune system extremely active and mature. It's busy. It doesn't have time to go look at where is the pollen, where is the dust, where is cockroach. He is busy, I got all these microbes coming one after another. I had all natural things. I never had immunization. I'm naturally immunized. That's why I have polio, this one, that one, all diseases. Diphtheria twice. lucky to be standing in front of you. So, Dr. Ramaswamy can vouch for that. So, now everybody is immunized. Okay. If you say how many children have, this morning I saw one patient, 18-year-old girl, எவ்வளவு பசங்கள் ஒன்று தான் சரி கொடுக்கலாம் that is average ரெண்டு சரி மூணு மூணா நாலு ஓஹோ என்னமோ சரியா இல்லையா 4 means something problem 5 means finish mental hospital something is so immunologically 5 is good for us. We were 16 of us in our house because they get married and they stay there, they have more children and also babysitter also stay there. So overcrowding is good for immune system not to develop allergy. Now with the nuclear families, the immune system is looking for something to do, and that is what allergies result, because it will start reacting against all these substances that we never pay attention to, which is just mind, cockroach, pollen, nothing you can see, but immune system will look at all these different foods. See, but food allergy is different. I tell you why. What we found, this is very similar to what I showed you the last slide. So there is one sentence I put, I will go and then shift. We have been doing something right without knowing what it is. Okay? Our in India, we have a built-in tolerogenic environment, but with all the lifestyle that is changing, people urbanization, and people's life, the type of food they are eating, the type of life that people are leading, and both parents working, child coming from school and comes, and what does he do? Any first thing he does? Anybody know?
Socks and shoes.
Mobile.
Mobile phone, correct. That is there even without the school. First thing is mobile phone, including bathroom, mobile phone. First, generally, he will start. Oh, why did I come to the bathroom? Oh, okay. That is there. Other than cell phone, the other thing these people, children do is they throw the book. First thing he will do, run to the refrigerator. And we, as we were when we were there, there's refrigerator actually only in America. Here I saw in the hospital, not at anybody's home. And refrigerator is where you keep the food forever. So when we were growing up, they cook the food. Morning they cook food at 6 o'clock, 7 o'clock. By 8 o'clock, 10 o'clock food, no more food. You have to cook lunch, no more food at 3 o'clock. Again 7 o'clock, one more cooking. No more food. At 10 o'clock, I'm moving to 10 o'clock on travel in Alita. But now food is there all the time, 7 days. So he knows where the food is, he takes that ice cream, whatever thing. And ice cream was a luxury. I would probably eat the ice cream twice a year when we were children. With all begging, we used to have, please ice cream. No, but also we were afraid we'll get typhoid. And now ice cream is available in everybody's house. So this fellow will take ice cream. You lie down on the carpet, put the video or look at the phone and eat this one. So they say respiratory diseases, epidemic of respiratory diseases which includes asthma, is occurred because of 3 reasons. 1, refrigerator. 2, carpeting. 3, leaves. Forgot. Okay. It's probably lying down and weight gain. Obesity. We know that obesity is an inflammatory condition. Asthma is inflammatory condition. Okay. All these are all inflamed. So what now we have is because of the lifestyle, we have inflammatory society, not infested society, and not infected society also. Diseases have come down. But everybody now, if I go to pediatric floor in Mysore, I don't see all those IVs running. I don't know, I have not seen Masonic Children's Hospital yet. I have not, inside I have not come. So far looks very nice. So when we go, we don't, in Mysore, we used to have always IVs running, dehydration. This, not anymore. Nebulization. Or some child sitting and vacant look, or some other therapy is going on. So a lot of them are autoimmunological diseases, psychological diseases, inflammatory diseases, cancer, diabetes. These are the diseases we have. We We don't have typhoid, cholera, and hepatitis. So all these things have what is looking the tolerogenic factor, which we always talk about, is slowly being thinning now because of lifestyle, and allergies are creeping back. So we'll go. So this is the Indian data on food allergy. We always thought India, the food allergy is more confined to children, but now we are seeing adults also. And if you look at IgE level in India, now I already told you we are all high producers of our immune system. So average IgE in India is 500. What is the average international figure? 150. Our immune system is 3 times more active. So never do total IgE on your patient, because the lab will report it as high. And there is a thing called IgE. Your immune system reacts. Generally we think it is proteins only, but it's also, there's a thing called CCDs, carbohydrate component derivatives. So the immune system will also produce IgE against carbohydrates also. So it will give a lot of false positives. So do not do high IgE, total IgE, because it's going to confuse you. Do specific IgE either by skin test or immunocap, we call it. So Indian population has a high IgE, so not a good screening test. And this test, this is a very complicated slide, but the reason I put in is many countries are being compared here. It's a global slide for food allergy, global slide. I cannot go through the whole thing, but the summary is self-reported adverse reaction to children is one of the lowest in India. Self-reported adverse reaction in adults is also low. Prevalence of sensitization is very high, and prevalence of sensitization by skin test is also low. So basically what it means, food allergy in India, allergy is low, sensitization is very high compared to many countries. So this slide, just pay attention to this slide, that is, it says all these different countries we are controlling. Sensitization to looking at any food in India is 26.7%. That is, if I skin test 100 children, 26 of them will show positives. But then I sit down with these children and take a history and see what really, are you having an allergy? Only 0.11 will have allergy. See, there is a huge dichotomy. So, lot of false positives. So, changing scenario in the food of allergy, there is a very interesting thing that happened in 1998 when Dr. Lack, Gideon Lack, whom we invited in as a speaker to CMC Vellore just a few months ago, he came and spent some time with us. He came up with this incredible theory called dual allergy hypothesis. What is dual allergy hypothesis? All these years we thought whatever we ate is what we got allergic to. So many times we would say, don't take this, don't take eggs, don't take milk, don't do this, introduce peanuts at age 3, introduce milk at 1 year of age, introduce egg at 3 years. So we always worried about introduction orally. And then when we did all that, then at the end we saw that more children had food allergy by eliminating. Then they came up with the thing and said, it is not the oral route, it is a non-oral route that is more important. What is a non-oral route? Non-oral route is more important in sensitizing you, and that is the skin. So foods enter through the skin, foods enter through the lungs, foods enter through your inhalation. And the skin and respiratory tract are the areas where foods will enter, and your system will produce what we call a sensitization. Actually, the food that you eat is more tolerogenic. That is, the reason is the type of T cells, type of B cells you have in the gut is very different. Immune system in the gut is very different from immune system in the skin and respiratory tract. Now, I had this morning pongal, also some upma. My wife she likes puri. My children had nothing. So, as a family, we took at least 25 different antigens, food antigens. You must have had much more complicated breakfast. so, so you must have eaten 50 antigens. But everybody is sitting comfortably. Reason is there is a thing called oral tolerance. We all have what we call as oral tolerance. It's a God-given tolerance where our gut immune system will look at the food and just say ignore it. No, don't bother. Don't bother. And I know he's protein, he's a starch, this one is there, egg is there, milk is just forget it. So the antigen presenting cell, which is an integral part of presenting these antigens to the T cell, it is a what we call as a non-professional antigen presenting cell in the gut. The same antigen presenting cell which is present in the skin is called a professional antigen presenting cell. It will say it will really is immunogenic. So how does food enter the skin? It's a question. Now, the genetic defect in atopic individuals or allergic individuals. Atopy is a genetic word, allergy is a clinical word. Sensitization is immunological. This class, all our DA students got it ingrained. Even in the sleep they will say sensitization is immunology. So we ingrain it in them, these three terms. So all these atopic and allergic individuals have what we call as a compromised epithelium. All your patients have what we call as a leaky epithelium, porous epithelium, holy epithelium, not HOL, holy, whole. So reason is material between the cells, epithelial cells, is compromised. It's not good. So if you want to understand clearly, here it's carpeted, but if you remove there's a flooring. The flooring is there, tiles are there. Tiles are kept close to each other by a substance called grit. So grit is the one that keeps the tiles together. So when you walk on the tile, if the grit is okay, flooring is okay. If the grit is weak, flooring is gone because water enters through and the tiles comes up. Okay. That is exactly what happens in an allergic individual. The substance between the cell is not good, it is weak. So the cells become porous. And all these different pollens like grass pollen, tree pollens, dust mite, cockroach, they all have proteolytic enzymes in them. Like the dust fecal matter is what we are sensitized to, not the dust mite. So they all have proteolytic enzymes. Pollens have proteolytic enzymes. Cockroach has proteolytic enzymes. So proteolytic enzymes will make it weaker by working on these proteins between the cells. Makes the hole bigger. So that is when the food, that is where all the pollens enter, that is where the foods also enter. So allergy is an epithelial cell disorder. It is not IgE. It's an epithelial cell disorder. So in people with food allergy or or susceptible to allergy, their skin is porous. You can't make out looking at it. So you go to this food court, Chinese food is given, Malayan food is given, Vietnamese food is given. Hey, very good place, very good place. We'll go there, we'll put the child there, you clean the table. Oh, table is very clean now. They have analyzed the tables. They have taken these scrapings, looked under the microscope, did molecular studies on those particles. They found that there are 50 to 60 antigens on each of these tables. Each table has chicken, shrimp, rolled, some unknown type of animal proteins, everything is there. So these proteins have entered through the skin of the child and sensitizes. So it is not uncommon for us. They come, the children, I am vegetarian 100%. My wife doesn't want she will run away if I have one live chicken coming there. Chicken, no way. Our kitchen has no place for chicken or eggs, 100% vegetarian. Child goes to the doctor, allergy doctor, his kid tests, your child is sensitized to chicken, egg, shrimp, this one, that one. She will go banana. So, yo. So I never have any such things. We are 100% vegetarian. Then you have to explain, it is not what you gave, it is what it has entered through the skin. You go to a restaurant, yes. You put the child on that child seat, yes. Child is playing there happily, right? That is enough. it is already entered. So that is called dual sensitization, entering the skin. Same thing happens, they found it occurring in the respiratory tract. So you go to the kitchen, food antigen is in the air. Food antigen is floating in the air. You inhale, the food antigen goes through the respiratory tract. You form IgE. So food sensitization occurs through skin and respiratory tract. Food tolerance occurs through the mouth. So that is why Dr. Lake came up with this incredible study. This I already just told you. And what we call as a leap study, he came up with this extremely breakthrough type of study called what we call as a leap, learning early about peanut study, where about 628 children, high-risk children, were taken. And one group, they fed peanut. Another group, they eliminated peanut. After they did that for a few years and they stopped giving peanuts to both the groups. Then they reintroduced the peanuts and they found the children whom they give peanuts early, they fed them, had 75% less allergy compared to the peanuts in the group where the peanuts were eliminated. That means elimination of the food actually caused more allergy because it was going to the skin, whereas ingestion of the peanut, it's produced less allergy. So what it also tells you is by ingestion, what has happened? It has shut off the sensitization to the skin. It has shut off the sensitization from the inhalation. So that is what happened. It shuts it off. So giving food early shuts off sensitization to the skin, shuts off sensitization to the inhalation. So this is a breakthrough type of thing. That is why now pediatricians are advised, introduce allergenic foods, introduce milk, introduce egg, introduce peanut early between 4 and 11 months. Now, again I go back. This is Western data. Are our children not the same? Are our children not the same? Are we different? We told you. So there was a Singapore researcher whom we invite him regularly to our programs, Hugo Ian Beaver at National University. He looked at it and thought, you don't have to eliminate these foods. You don't have to introduce these foods so early in our children. Even if I introduce after 2 years, they still have low allergy. It is not so. We are different. So we don't have to go and introduce all these foods in our children right away. So the Asian data could be different from Western data. So please wait for recommendations. So don't blindly follow all Western data. So that is the message here. So maybe we are different. So this was another very, very incredible study we did. So there were 1,200 children, 3 groups, almost like 300 in each group or 350 in each group. And cow's milk was introduced right at birth itself, within 48 hours, one group. Another group, it was introduced before 6 months. Another group after 6 months. So very early introduction of cow's milk, early introduction of cow's milk, late introduction of cow's milk, followed for next 6 to 7 years, found that late introduction of cow's milk developed maximum milk allergy. The one that did not develop milk allergy is when you introduced very early, first 2 weeks or in the first 6 months. So introduction of cow's milk early will prevent food allergy down the road. That is what this shows. See how the tables have totally turned now. So what we used to say before and what we say now, we used to say avoid allergenic food item, now we say introduce. Avoid cat and dog, now we say have dogs. Why do I say you have a dog now? I told you that village people had high microbial load, have used cow dung and this dung and all that, and they have cattle and that's why protected. They found that having a dog will have enough microbial exposure like a cow dung also. You don't have to have a cow dung. Have a cow sleep in your house. Nobody wants a cow sleeping in the bedroom. But they don't mind a cat or a dog. dog. So dog has incredible microbes. So having a dog indoors will protect you. So now we say have a dog. Especially there is a thing called window of opportunity. Window of opportunity starts during pregnancy and it will go for 18 months post pregnancy. This is having a dog during that period will get the maturity of the immune system and the child will not develop allergy. So having a dog is equal to having all those cow dung exposure. Avoid infection. Now we say daycare is good. Put the child in the, so get more exposure to microbes. Avoid peanut. Now we say food allergy is untreatable. We used to say no, it's treatable. We use our oral immunotherapy. You want me to stop now or just give me 10 minutes? Or is it
Please,
okay?
please go ahead, 10 minutes, sir.
10 minutes, okay, sir?
Please, please.
Is it okay?
Yeah.
I don't know. I just keep on talking.
Oh, please. Please go ahead.
So what it means is early exposure is protective. Late exposure or prolonged avoidance is not protective, sensitizing. That is the message. Again, Western data. Now, Eastern Western data. Yes, I already have mentioned it. This is the data to support it. That when we were studying, that you don't have to introduce too early. You can wait. Now, acculturation. I already told you about the young IT couple who moved from India to New Zealand, and their children are 100 times more prone to develop food allergy compared to the couple who remained in India. And it is higher than the local Caucasian population. Higher than the local Caucasian population. So that's what it's a food allergy in maternal diet. What it showed was, this study showed a very interesting thing. They looked at different type of foods the mother is taking and studied what happens to these children when you give these different foods. They looked at high carbohydrate diet, high meat diet, high bakery diet, and found that confectionery group, that is the bakery food group, that is all these donut, all this cake, all these bakery products, all yummy products, we call it, very, very good, tasty, causes more allergy in children if you give it during pregnancy. Meat produces the least, but the vegetarian food, where you got these high fibers, causes the least. And that is because of this particular product called, it's a type of fatty acid, lower, I forgot the term. It's a some type of a fatty acid which is more protective in this type of group. This was a study done in Asian children, Korean children. Yeah, maternal confectionery group significantly associated with food allergy due to trans fatty acids. That is what it is. Trans fatty acids, TFA, is what is the culprit. Because of the high trans fatty acids, what caused the children to have allergy, and that happens with this type of food. So when mother asks, what type of food should I take? Tell them avoid bakery foods during pregnancy, avoid high sugary food. So it is not something we are imagining, this has been proven. Now, what is the type of food you give to the children? You are breastfeeding the child, and child seems to be not satisfied, still hungry, and you want to give what we call like an additional complementary food in addition to the breast milk. And they have tried different formulas and different type of products, but what they found, the best food that you can give to a child when you want to complement food allergy or when you are replacing is homemade food. The same food that you eat at home. Shataman, Coimbatore, more sadam is what you give to the child. And the same food you just grind it. The reason for that, it is the best diversified food and promotes the best microbiota than any bottled food. And it is also incredibly affordable. You can't tell these patients, go to that pharmacy, buy these different elemental food and all these different bottled food. Because I don't know, if you look at the composition of the bottled food, 80% water only. Okay. And none of these probiotics and all that are heavily marketed. You don't need all that. Our Morushadam gives all the diversification of the microbiota we need. It's one of the best things you can do, is to give homemade food. So then they looked at the evidence. So it's actually a well-done study. They found the prevention of food allergy evidence is A grade. A, one of the best thing you can do is give the diversified homemade food. Prevent food allergy development. A grade. And asthma is also pretty decent. Atopic dermatitis, so B plus. Prevention of sensitization, that is just sensitization, is also B plus. So the child can still get sensitized, not allergy. Prevention of eczema, not sure. So anyway, the European Allergy Immunology recommended increasing food diversity to prevent later allergies, and the best thing you can do is to give home food. Microbe is, I'm coming to the last. So microbe is a very, very important thing that we need to be aware of. And one thing is we are all microbes. So we have microbiota. We have different type of microbiota in the skin, mucous membranes, sinuses, lungs, and it is associated with every disease possible. And this is like one of those fashion words. Now fashion words in medicine, it's very, medical professionals have these catchy words. For a while we always saying environment, we say pollution. Then we started doing this gene-environment interaction. Then we started saying vitamin D. If I don't know, I must be vitamin D. Escape mechanism. My child is not doing school at school. What's the vitamin D level? It's always low. Yeah, that is what it is. Vitamin D. Then patient says, okay sir, I will give vitamin D. Please go. Now, the one is microbiota. That is the magic word. Something is not right, my child is not thinking well, be hyper, must be microbiota. So every disease is microbiota now. Schizophrenia microbiota, asthma microbiota, chronic sinus microbiota, psychological upset microbiota. So all these things have shown, mice experiments have shown susceptibility, this tolerance. That is, we have what we call as a susceptible microbiota. And there's a tolerant microbiota, which actually makes you more prone for these diseases. And also, depending upon the type of food allergy, you have a type of microbiota for each food allergy. If I'm allergic to milk, there is a microbiota which is peculiar, specific for that. If I'm allergic to egg, specific microbiota for that. See, so these are the things they have found, that there's a specific microbiota for each food allergy. So they actually use that data to have therapeutic interventions. So what is the therapeutic intervention? So microbiota assist in creating an immune tolerant. Okay, so this is the actual function of the microbiota, is making the epithelium stronger. I told you it is a compromised epithelium, weak epithelium. Microbiota makes the epithelium stronger. If you have a normal good microbiota epithelium, and breast milk is one of the best things that does it. It promotes oral tolerance by promoting one of the best microbiota. And all these different things are given, and one of the things that looks promising, which sounds yucky, is what we call as fecal implants. Fecal implant actually has incredible diverse microbiota and used as a capsule, and has been shown very promising. So you just have to close your eyes, pray to God and swallow that capsule. And then your microbiota, Shiva Shiva, and then your microbiota. So summary slide is what I just told you. That microbiota is something that we are now thinking, looking, therapeutic options are coming, and we think this is something has some promise. So cross-reactivity means sharing of antigens between pollens and fruits and vegetables. And this is something you just to be aware that if you are highly allergic to pollens, there are certain fruits and vegetables also that will bother you. And this is something you just have to know. All the details, the TAA students will know. The allergy specialists, you don't have to know all the details because it's very confusing. So now changing gears to my own life, I am done with food allergy. Sir, with your permission, Dr. Karthikeyan asked me, can you talk a little bit about lifestyle?
Please go ahead, sir.
If I am looking at all your faces and looking at the assessment of the hunger ratio.
Please.
Please go ahead.
5 to 10 minutes?
Yeah, please.
So, the reason why we talk about is this is meant for younger doctors who come to us from different walks of life to our training programs. And our training programs, all of them, not just we started it since we were, we want to make sure these people will become not only good doctors, better human beings. You should be a good human being to be a good doctor. You can't be other way. You first become, because doctors have a peculiar, we are all sort of weirdos. So we are all trained in a particular way. We are all obsessive compulsive. We have peculiar type of stresses. Because here a couple of things what happens is when we are going to medical college itself it starts. People look, are you going to medical college? Oh, you must be bright. Oh, then you are going to, why are you taking medicine? I want to serve the humanity. That is the interview, medical interview. Why do you want to come to medical? I want to save humanity, I want to save lives. He passes, I want to buy Mercedes Benz. So that turns Mercedes. I'm not happy with Maruti, I don't want Maruti. It doesn't move properly, it goes like this. But actually Maruti goes as good as Mercedes. So, what I am trying to say, the expectations of the society is very different from what we can deliver. The society expects us a lot, but we can't deliver it because we are also human. So there is a dichotomy. And so when you cannot deliver what you are expected, it causes what we call as an internal combustion, which is actually also called burnout syndrome. So we start burning inside. So, right?
Absolutely.
Burning. So one of the ways to reduce the burning is to work at Methodist Hospital. I mean it seriously because when you give compassionate care without expecting, it cools down the fire. Okay. Patient is expecting to get some relief, you are giving it, but without expecting anything from him, not even a thanks. And that what is the beauty of this institution.
Absolutely, 100%.
And that is what we also have found, that giving makes you happy, receiving makes you unhappy.
Absolutely, 100%.
If I have a lot of property, I have more sleepless nights. I give away all my property and sleep in a mat, I sleep there. I sleep in a foam mattress which is full of dust mite. I sleep on a mat which has no dust mite. So simpler life actually makes people much more sensible and less complicated. But a lot of times because of the society pressure, we are pulled and pushed and elevated and pushed down everything. We become like stooges. So our personality changes. So it's very difficult. So the only way we can is increase the awareness and make us come down to reality. And that's what we do in these interactive sessions at CMC. On a Wednesday night, we give them dinner and do interactive sessions so that we introduce each, this you can talk for hours. So we put different points. It's not a lecture, it's interaction. I will just put one point and say, what is your feeling about it? Sometimes young people have much better input than an older fellow. because he will have, his thinking is much more sharper and he is much more current. I think in 1970, he thinks in 2020. So that is what makes it different. So, a few slides. So, when we say, when you are in the hospital, be a physician, but not when you come home. So, as you are going home, take off your tie and all that. First, get your stethoscope off the neck. That is the one that chokes you. You need it, but first you take off the stethoscope, take off the tie. So cerebral flow gets better. And when you enter the house, you are either a husband or a sister or a brother or a friend or something like that. So, never enter the house like a doctor. Okay, do not expect your secretaries. There is no secretary there. There is nothing. In my office, I ring a bell, 3 girls will show up. Sir, what can I do for you? At home, somebody else rings the bell. I go inside, what can I do for you? This is true. Enna pannattom is the question. Now, we tell, this can be different depending upon the culture, but in America, all the husbands are very good dishwashers. What degree you can put on dishwasher, best dishwasher in the world is my dad. That is what our qualification. In the house, not MB, MD, MD, DM, nothing, DND. It is DW, dishwashing. That is degree in the house. So we are all very good dishwashers. So I tell my students, as soon as you enter the house, don't go sit in that very comfortable sofa. Put the TV on. The worst thing you can do is to sit down and watch the TV. Shut off the TV. It's of course lot of damage. And do not sit in the living room. Go directly to the temple of the house, which is the kitchen. Kitchen is the temple. That is where everything works. Everything happens. And the leader of the kitchen is the lady of the house. Okay. The lady is always busy. And to compensate, the only thing you don't go and say start cooking. She will be thrown out right away because you don't know the composition. I don't know where the curry powder is. I still put it down. I need first to pour. So that is the instruction. But she won't tell that when you start washing dishes. She knows this is a dumb job, let him do it. You don't need much brain. To wash a dish, you don't need any brain. What you need is some moving. So that is the least stressful job is dishwashing. So one of the things what happened to me, the last thing before I say story of President Clinton. I went to Swarthmore College, where my son used to go to college. And he had a scholarship to go to UK. So the same professor also was in the selection committee to select Bill Clinton, who was a Rhodes Scholar, went to UK. So we went there and this professor was a widower. Old fellow, 88, still active. So my wife said, the professor, we used to visit him, sir. So I will cook for you, I will cook something for you. I said, okay, I'll wash dishes also. So that's all I can do, washing dishes. I look up there. On the wall there is a little letter which is framed from White House. And in the letter I start reading, washing dishes, reading the letter. In the letter it says last sentence, I also wash dishes. I also enjoyed washing dishes, signed Bill Clinton. So I said, wow, this guy has visited the professor. He has also washed the dishes. Once I said that, one of my students got so excited. 6 months later, he wrote me a letter from CMC, from Delhi. This is real fact actually. He wrote, Dr. PK, I'm washing dishes. My wife is talking to me more now. Character life has improved. Now she's talking. So I write only 2 words, continue washing. Email, right? You can do that. Continue washing PK. So after about 8-9 months, my wife is pregnant. Same word, continue more washing. Then baby is born, beautiful baby. I didn't want to say it's a washing baby, but very good, congratulations. So he said, come home. We went to their house. Very nice couple. I didn't want to tell them, this is because of dishwasher. But we spent some time. Muslim family, very nice couple. Mother is a history professor who lives with the parents. So Just a story I wanted to share. So this one is my own formula is keep your wants simple, maintain. The only thing, the message of this slide is have 1 or 2 hours free for yourself. 1 or 2 hours. Have a free time. That free time you can do either do walking, you can do running, you can do reading, or you can do nothing. Nothing also is good. Nothing. So I wrote that word nothing. I said I was not sure how do I back up this word nothing. And fortunately, an article just came 2 days ago in Indian Express. And this was this guy. Most everybody knows his name. Nandan Nilageni is the architect of ADA. He's co-founder of Infosys. And he said, I am dividing my time in 3 ways. One is corporate leadership, then key technological intervention, and nothing. And same amount of 2-3 hours, nothing. 2-3 hours. So what it is doing nothing actually is what we call as recharging. You are getting the energy recharging. So nothing actually is not nothing. There is something, and that is recharging. So I will end here. Thank you very much for giving this opportunity. No, I took more time. Absolutely enjoyed visiting the Masonic institution. And I again want to thank Dr. Pudupakkam, the whole group here for inviting me and my family here to spend wonderful time. This is probably my 40th lecture during this academic tour in the last 6 weeks. So tomorrow I am going to disappear into the Annamalai forest. So we are looking forward to going and spending some time quiet with the elephant and tiger, or maybe nothing. Let's see what. Thank you so much.
Einhorn's orations, this is one of the best lectures we have enjoyed. And I think he has given a very valuable way, very valuable lessons to live our life. And I'm very happy he has stressed on the way the doctors should live. A very simple life. Never hurting the eyes of others. Very, very important. Never hurting the eyes of a very simple life. That gives you a lot of happiness. I'm glad you stressed on that. Very happy about it.
Thank you so much.
It's my privilege to extend my heartfelt gratitude on this special occasion. First and foremost, I would like to express my sincere thanks to Professor Vedanthan sir for graciously accepting our invitation and delivering this an insightful oration on food allergy changing platform. It was a wonderful talk, sir, and very entertaining as well. Your expertise and perspectives have truly enriched our understanding on this evolving field. Special thanks to our MR sir, who has been an inspiration for every pediatrician in this city. We appreciate his dedication in organizing this oration year on year in honor of his mentor, Professor Einhorn. I would like to extend my sincere gratitude to our esteemed senior doctors, our Ravikumar sir, Dr. K.S., Nandini ma'am, Usha ma'am, and all the senior pediatricians who are here, for their invaluable contribution in shaping Masonic Hospital into what it is today. My heartfelt thanks to all our doctors, all pediatricians in the city and from other city as well, and all the well-wishers who have joined us today and making this event a special one. I also take this opportunity to appreciate the efforts of our general manager, our maintenance team, our IT and digital marketing team, marketing and catering team for their coordination in ensuring the success of the event. I also like to thank our Reddy's Lab for sponsoring for today's program. As we conclude, I warmly invite everyone to join us for lunch following national anthem. Thank you.